Hello and welcome. You're watching FYI. I'm Sonal Mehrotra Kapoor. I'm fully vaccinated, so is it okay if I take a vacation? Will a domestic vacation make more sense than, say, an international vacation? Is it okay if I take a road trip versus taking a flight? Should I be staying in an independent Airbnb sort of a place or a hotel? Is it okay if I go and take a vacation to share food in a space where people are there? Well, all these questions have dominated your mind. It's dominated mine as well. So I thought the best way really to cut the clutter on this and arrive at a decision is talk to doctors and also talk to hoteliers, which is exactly what we've done on FYI today for you. We'll be talking to experts and getting their opinion on what should be your safety toolkit in case you're fully vaccinated and hoping to get some time out in these really sad, troubled times that we've all seen in the past 2 years now, if one can really say that. So let's go straight into our panel today. We've got with us Dr. Sumit Ray, Head of Department Critical Care Medicine, Holy Family Hospital with us. Thanks for your time, Doc. We've also got Dr. Sanjith with us. So it will be very important to hear from the doctors on what they are prescribing is the best way to move forward here. Also joining us are hoteliers. We've got the MD of Sarovar Hotel, Ajay Bakaya, with us. We'll be joined shortly by the CEO of Neemrana Hotel and also the Vice President of Green Park Hotels in Chennai, Sudeep Sen Gupta, also with us. All right, I'm told also the CEO of Neemrana Hotels is with us. Thanks for your time. Let me begin with the doctors here first. Dr. Ray, I get asked this question very often, I'm sure so do you, of people saying that, well, I'm fully vaccinated now. Am I safe to travel? And if yes, I'm going to a hotel, should I ensure that the entire staff is vaccinated, or how should one really be thinking?
So I think if you're fully vaccinated and one doesn't have too many comorbidities which are high risk situation at this point of time, I think one can travel. I believe one can travel and stay in hotels. And for that, a few things are important. One is how that hotel is organizing the public space. Is there adequate distancing in the public spaces where people are going to meet, like the restaurants, the escalators, where they queue up in front of the reception, etc. That is one point. And second is, how is the air handling units or the ACs being managed? How many circulations of air, how many changes of air circulation, is there adequate ventilation? These are the important questions to ask for the hotel that you are going to visit. So yeah, these are the main things to the ventilation, because primarily, as we know now, it's aerosol spread for this virus. And obviously, if the staff should be fully vaccinated, and in the public spaces, use of mask is absolutely essential for everybody.
Right. So some important pointers over there about staff being vaccinated, the air circulation, public space, how spaces, how are they being managed? I think also the kitchen, how that's being managed is also very pertinent. Food, such a central focus of how all Indians travel, really. Let me bring in Dr. Sanjith also with us. Doc, what are your recommendations, especially with the breakthrough cases, which have been reported in the recent past, especially coming in from Kerala and other places? That put a lot of us, got us thinking about, we don't know if this is safe. If yes, then how much? To what degree do you think people should be venturing out? And, the question often is it safe to travel for leisure, or should you at this point be prioritizing travel only when it comes to work? All right, I'll just wait for that line with Dr. Sanjith in just a bit. Let me go to Sonali Kaikar now. She is the CEO of Neemrana Hotels. Tell me, you've just heard from the doctors. This is what they're prescribing. Is that the thinking inside the industry as well, and how are you implementing it?
Hi, good evening. Definitely, I think I'd like to second that opinion. It's very safe to travel, especially if you're driving in your own car. And, if you're entering a Neemrana property, then you have access to plenty of open spaces. We have digital check-in facilities now as well. There's adequate social distancing. Despite the fact that we have that we are heritage properties. We've adapted our way of working. We now provide room service as well. We have staggered timings. We have lots of protocols for hygiene, which have become more frequent. And our processes in terms of how we actually follow that has become much more stringent than before. And I think we've seen a fantastic trend, because for us as a hotel chain, we've had steady occupancies once the lockdown restrictions eased out. And in fact, in July 2021, we've done extremely well compared to pre-COVID, which was July 2019, if one has to actually compare the two. So I would definitely encourage all, all our guests out there to, have that comfort to travel. And our team is entirely vaccinated, and we also do thermal scanning as well. Thank you.
Right. I mean, I would be a little cautious in saying if we are encouraging this altogether. The idea is to understand if it really is the right way to go forward. On which point I want to go back to Dr. Ray at this point. Dr. Ray, we've seen in the recent past some disturbing images that came from Himachal Pradesh. We saw some disturbing images from Goa as well, and immediately after those travel started, we saw the spike. It was very crystal clear. It couldn't have been more in terms of numbers, in terms of percentage, in terms of hotspots emerging in those areas as well. So then when you say travel, are you advising people, okay, take a vacation, but ensure that you are in the confines of a place? Maybe how do you see that?
So the confines of a place is even if you go out, you stay in a hotel. These are the points that we spoke about. But when you are accessing another public space there, like if you are going to a restaurant or a bar or a nightclub, etc., obviously those there also the limited number of people should be allowed. Is the ventilation adequate? How is the AC system working? Are there exchanges enough? So restricted entry to those places. Certain probably nightclubs at this point of time with large numbers of people is not acceptable at this point of time, right? So there, in the travel process, there has to be certain kinds of restriction and certain kinds of limitations in the way we move around. But having said that, I think there needs to be a certain kind of opening up, but also a watch. A watch has to be kept both by the industry in their own spaces and by government, to keep an eye that overcrowding, etc., doesn't happen. So it's not that it is free for all, but the restrictions apply even for holidays to a certain extent, that you cannot be in a public space in large gatherings. The same rules have to apply. And who can do the checks and balances? In the hotel, it has to be the industry, and outside the hotel in the public spaces, it has to be the government. So it has to be, even if the government wants business as back as usual to a certain extent, because the economy has to kind of get boosted up. So then we have to open up to a certain extent, but keep a constant eye on what is happening.
Right. Keep a constant eye and have your checks and balances within. I think you raised a very important point, especially those who have comorbidities need to be careful. We've seen that as well. But talking about the economy, on how this is working out for the sector, let me bring in Ajay Bakaya, MD Sarovar Hotels, on the program with us. How are you internally processing this? I mean, she talked about the trends earlier. So now Sonvi actually talked about the trends, about how it's actually getting up, and we keep listening about this and keep looking at social media and people actually now traveling out. But the concerns are very valid. Do you have sort of a safety toolkit within the system that you would like to make your potential sort of travelers at this point be aware of?
Sonal, yes. So to begin with, I'd say there is a doctor's prescription necessary for people to travel. Psychologically, people are cooped up and really want to travel and want to get out of their homes. And that's one of the reasons you see these big crowds in places, that what you talked about, the reports on Manali and other places. So I think there is a need, there is an urge, there is a psychological, physical, physiological need to get out and be amongst other people, or to get out and be amongst your own people, and relax and let your hair down. That's so the need to travel is very strongly there. I have traveled extensively by air, both within the country and outside, in the last few months, and I can say that air travel is perhaps safer than it's ever been in this country. Most of the airlines are enforcing their rules. Yes, you brought up this issue of if you are traveling, would you rather be confined to a particular space? The answer is no. You certainly don't need to confine yourself to the four walls of your room. But if you're traveling for leisure, the chances are that you have a property that offers you space to move around in. At the same time, we would certainly not recommend people going to places where there are large crowds.
So how are you maintaining crowds within the hotel? Do you have limitation on the occupancy?
We have limitations on how many rooms we let out. We have limitations set in place by state governments and local governments in a lot of places. We have limitations on curfews, so your nightclubs don't exist anymore in the system for a while till things get a lot better. In most places, swimming pools are not operating or operating under very tight supervision. So a lot of those checks and balances are in place. We have somebody mentioned air circulation. The anticipation or the demand or the expectation from branded hotels is that they provide a certain level of safety. Hotels of a certain caliber will always have treated fresh air systems. So if you're living in a hotel room or in any public area, the air is circulated 3, 4, 6 times in 24 hours.
I actually want to pick up on the point of air circulation, because you said that you think air travel is actually safer. I want to get a doctor's perspective on this. Dr. Sasidharan is with us. Doc, what's your view? A lot of people wondering if road trip is still something that they can undertake at this point, but flights, they say, a big no-no to still.
So in fact, the only travel that is the most safest of the lot is air travel. In fact, it is better than an intensive care unit is what we put it as. It's as safe as an intensive, more safer than an intensive care unit, air travel, because the amount of air changes that you have on a flight is much higher. But it is definite that travel is definitely one of the mechanisms by which the virus has spread globally. We know that very clearly. And it is very important for the hospital and tourism industry to take care of this such that they avoid the usual suspects, which includes crowding, which includes closed spaces, and which includes effective ventilation for all vaccinated people that are entering into these kind of places. Definitely travel has a significant impact on COVID-19 spread. It will definitely go a long way for the hospital industry if they have to reduce the number of cases and the geographic spread.
Right. I just quickly want to get in a word from Dr. Ray as well. Air travel safer than ICU?
Yes, I won't say that, but the air exchanges, as we were talking about, yes, it's not the usual air exchanges that the CEO of Sarovar Hospital was talking. I think the number of air exchanges have to increase. The recommendation of ISHRAE is that it should be at least 10 to 15 rather than the usual 3 to 6 that the hotel industry speaks about. So the air exchanges have to increase, absolutely. For safety, the air exchanges need to increase, or you have systems of ventilation. Like in some hospitals, I'm just giving an example, during the peak COVID crisis, when they could not change some of the anatomy of the place, they put in exhaust fans to increase the ventilation, because ventilation is of essence. That is the most important, and mask, because it's an aerosol generating, and distancing. These are the main things. Hand washing, etc. is important, but second to these measures, particularly in a public space. So,
all right, we'll go to our other guests as well and talk about this air exchange and how exactly it's panning out in the rest of the hotels as well. I know our panelists are waiting, but we'll slip into a very quick break. Back in a moment. Welcome back. Is it okay to travel if you're fully vaccinated? That's the question we're asking doctors and also hoteliers to try and understand their arrangements at this point. Let me go to Sudeep Sen-Gupta now. He is the Vice President at Green Park Hotels, Chennai. Sudeep, Dr. Ray was raising a very important point about air exchanges. Could you give us an update on what it's looking like at your hotel?
So, well, first of all, thank you, Sonu, for having me in the program. I think hotels, I'll probably come to the air exchange part a little later. But first of all, I would like to say that, hotels have always been known for, safety and hygiene. It's always been a part of, when it comes to safety and hygiene, hotels have always had very strict protocol. Now, of course, things like sanitation and all that has come in. And today, if you look at public spaces, hotels would probably be one of the safest. simply because enforcement of COVID protocol in hotels is probably much higher than anywhere else. Because the processes set for things like sanitization, hygiene, and etc. has always been on the higher side when it comes to hotels. And today, of course, there has been so much of adaptation in the last 1.5 years. Including bringing in technology to sort of handle a lot of these aspects. Like the lady, she was from Neemrana, was talking about thermal, scanning and all that. So I think with all that, hotels are definitely much safer. Coming to your air conditioning point, see, there are some set guidelines given by the the government of India, where the temperature of the room typically is around between 24 and 30 degrees, and not lesser than that. The air conditioning, the humidity has to be maintained in between 40 to 60%, and that's what we try to keep. Probably drier areas and drier climates, the temperature can be set at a slightly higher level as well. The air conditioning systems of hotels, as Mr. Bukaya pointed out, the treated fresh air systems, the maintenance of these systems are very methodical and are done properly always. It is not only because of COVID time, the cleaning of the filters and preventive maintenance of all that, and the opening of the dampeners, to what extent it needs to be kept open to ensure the proper exchange of air. So these things, I think, make a hotel room probably much safer than not only room, in fact, public areas as well.
I'm not sure if I got my answer on exactly how many exchanges are there at your hotel, but let me bring in Mr. Praveen Chandar as well. He's the Senior Vice President Sales and Marketing for Indian Hotels Company Limited. Praveen, the question has always been, when it comes to reopening and unlocking, about lives versus livelihoods over here. But as a trend, I see people moving now, even when they are traveling, move towards more branded hotels, bigger hotels, because there is a level of trust, there is a level of maintaining hygiene levels and cleanliness and safety levels there as well. However, then smaller hotels continue to suffer, don't they?
Sorry, is that for me?
Well,
that's for Praveen.
Yeah, so there are two parts of it. One is that the basic standards that are required to stay in a hotel during the pandemic need to be always, they have to be put in place. So what really the government has done is that they have come out with multiple rules in terms of social distancing, what kind of air rate exchange you should have, what are the kind of touchless services that you need to implement. So it's on the overall industry to implement that. I do understand that the larger hotel chains are at an advantage in terms of being able to do that because of two reasons. One, because we are infrastructurally more adaptable, and second is that also there is a lot of cost which kind of goes into doing these things. For example, we were probably the first hotel company which launched Tajless Re-Strengthen, which was our protocols which we worked around in the entire company, in the entire hotel during your stay, right from the check-in to check-out, which kind of were the answers to what you need to do when you stay in a hotel during protocols of COVID. When it comes to smaller hotels, there have been, they do struggle, but I still feel that everybody has been doing the system, and I have a great respect for the industry overall.
Right.
And in fact, during the time that I have gone to smaller hotels, I have seen that they are also making all attempts to follow the process.
All right. I have last 1 minute on the program, and I want to give that to Dr. Ray. Dr. Ray, you've heard a lot of hoteliers talk about their arrangements. In your opinion, as a conclusion to this, do you think there are still gaps that need to be filled, and if yes, what?
So, I've been traveling during this time, not much, but for work, etc. And I find that most of the protocols in hotels are fairly well established. Having said that, there are a few things which has not actually, they are right in a sense that the government's order on this doesn't clearly state the number of air exchanges, but the ISHRAE guidelines say that there has to be these many exchanges. And I think that's the safer one to do, because it's exactly the same as the American Association's guidelines. So air exchanges have to be more than usual, and that is important. And also, as you spoke about smaller hotels, well, interestingly, smaller hotels, if they have separate ACs in each room, then actually the air exchanges don't need to be the same as larger hotels. So it depends on the, yes, obviously smaller hotels any smaller industry in this phase is facing worse problems than larger industry with deeper pockets and deeper funding. So that, having said that, yes, it is possible, I think, to use the checks and balances and keep them in place. And there has to be, the regulatory body has to be the government. And it has to keep a check on this, because we have unfortunately found in India that self-regulatory protocols don't seem to work in India. There has to be a watch by the government, and not just the hotel industry, all industries. Self-regulation has not worked in this country.
All right, I know Mr. Bakaya wants to speak, but I'm completely out of time here. I really hope, thank you all for your time, and I really hope if you have travel and a holiday on your mind, this has helped you make that decision a little easier. Thanks so much for watching. That's it on FYI today.